Okay, I called for this meeting to make some quick announcements, no? Nakikita natin ngayon na umaakyat nga tong cases dito sa NCR and neighboring provinces sa NCR. Dahil sa nangyayaring yan, there are some contingencies that we're going to do here in the city of Tacloban, which will be spelled out by Attorney Aldrin and Dr. Aglono sa office. But I'm just giving a heads up to everyone that there will be some changes pertaining to our protocol here entering the city of Tacloban. But more so, having those changes in order for us to prepare for the eventual rise in our cases here in the city. Hindi natin talaga maiwasan yan dahil capital city tayo ng region. And there's so many entry points, and the main artery by land to go to Mindanao is also through Tacloban. So I would really like to avoid what is happening in NCR. You know, it's been very difficult for this entire year that to balance our economy at the same time keep our people healthy. And sa nakikita ko, malayo pa ang solusyon na to eh. At mukhang tatagal pa to. Nakita natin sa ibang bansa, pati sa Amerika, halos 100 million nang nabakunahan nila, and yet they're still having a problem with a rising cases, no? Also in Europe now, nagla-lockdown na rin sila. Marami mga bansa na yan ang nangyayari. I think we also should realize that there is a bright future to all of this. And nakita naman natin, even our death toll is very low nationwide. So, you know, I still give a lot of credit to the national government for, you know, having their policies in a manner which, you know, we're able to balance more or less our economy and our healthcare system. Now, immediately lang masasabi ko ito, no? Nakita natin yung mga kaso natin dito sa Tacloban medyo mababa and in the region, no? My advice to Taclobanons now is, if you need medical attention from any disease that you're having, go to the hospitals now. Have your check-up, do it now. Huwag na kayo mag-intay. Kung magkaroon ng surge dito, ay sabay-sabay mahihirapan kayo. Katulad sa nangyayari sa NCR. Huwag tayong kampante. Nakikita natin, lalo na sa mga elderlies natin, sa mga may comorbidity, if you're due for your annual check-up, do it now. If you're due for an operation, if you can schedule it as soon as possible, do it now. That is my suggestion. Habang mababa talaga, halos talaga napakababa ng mga kaso natin. Kasi kung maghihintay kayo at biglang mag-surge yung numbers dito, at pag nag-surge yung mga numbers dito ay abutin ng mga 2-3 buwan, baka mahirapan na kayo. So I am just, you know, anticipating the worst. Now, what we've seen so far, dapat matuto tayo this last year. Ano nangyari? Okay? We're able to prepare for this. That is why we kept our numbers low or moderately low and more or less na control natin. But there are many things that we had to do. And one of those was really a change of lifestyle in order to anticipate. Nakita nyo naman, pati yung mga close contact, hindi ko na iniintay na mag-swabbing. Pag close contact ka, right away we have to isolate you. And we did that. And we were successful with that. So there are many practices that we did that, you know, I felt that made it more or less successful itong pag-control natin, itong pag-spread, no? Now, be that as it may, that we've learned from that, ito ngayon yung mga gagawin natin na very specific, more or less contained, and this is what we have to do. It's really strict monitoring. Kasi, alam nyo, it is pointless now to overreact or lock down an entire city. We saw it already. Ang number one cause ng pag-spread talaga yan ay mostly people that are coming from the balloon areas. Like NCR, those high-risk areas when they enter our city. Then, what happens? Family members do not report immediately to the authorities, to the city health office. That's why we're asking the barangay officials, even the city health office now, will be closely monitoring barangays, especially those returning residents coming from NCR and the high-risk areas. So we can closely monitor their situation para, alam nyo naman, narinig nyo na sa mga news na mabilis kumalat ito. So, kailangan talaga bantayan natin yung mga pumapasok. We're going to implement, as recommended by the City Health Office, that we will require now not only swabbing or antigen test before they return. RT-PCR, and yung details, sasabihin na lang ni Dr. Aglo sa inyo, no? Details na you have to have yourself tested temporarily while we have this surge in Metro Manila, because we don't want na we will be an additional burden to the national government. We already know what's happening, let's prepare for it. Nagsa-surge na sila, nag-umpisa na dyan sa Iloilo at saka sa Bacolod. Based on our monitoring na tumataas na ng mga cases nila. Hindi tayo malayo dun. Visayas din tayo. Sa eastern part naman tayo, no? So there's a possibility that will happen. So I'm urging Taclobanos, alam na natin to. Huwag natin paabutin na kailangan natin mag-lockdown. Umabot sa panahon na magiging super strict tayo at hindi na kayo makalabas ng bahay. Marami mawawala ng trabaho. Back to square one tayo. This is really entirely up to us. We can do this. We can do this together. Basta may pumasok, galing sa labas, nakikita ninyo, kamag-anak nyo, okay lang yan. Basta paki-report lang, paki-register sa City Health Office natin. Malapit na, para ma-monitor natin. At pakiusap talaga, huwag muna maglalabas, lalo na yung mga galing sa labas. And isolate yourselves first, observe. Be cautious. If we do that, malulusot na natin to. Nasa atin na to eh. Hindi natin kaya. Yung mangyayari sa Metro Manila, pag nangyari sa Tacloban yan, hindi natin kaya yan. Mahihirapan talaga tayo. So I'm urging everyone, please focus on that. Watch out. If you feel you have a family member that is always traveling outside of Tacloban, then do the necessary precautionary measures. If you need to wear a mask, do that. Ingat lang po. Kasi tatamaan natin yung mga mahal sa buhay, tatamaan natin yung mga vulnerable. Kaya ako yung nakikiusap. Kaya timing ang maganda nito na mababa pa ang mga kaso natin, yung mga kailangan pumunta ng ospital, punta na kayo. Kahit outpatient kayo, may papa-opera kayo, pa-opera na kayo. Gawin nyo na ngayon habang maaga. Because sooner or later, we have been monitoring, marami nang umaalis ng NCR at umuwi sa mga various na mga probinsya nila. Okay? Marami rin papasok sa Tacloban, alam ko yan, maghahanap ng trabaho. So a lot of people will be entering. So we have to be very cautious, we have to be very, very careful. Okay, so yun lang po ang pakiusap ko sa lahat sa inyo na ayusin natin. There will be some checkpoints that will be established only to decongest Tacloban. There will be a checkpoint that will be established dyan sa may bypass road to inform basically the public that there is a bypass road. If you don't intend to go to the city of Tacloban, then you can take that bypass road straight to Mindanao, straight to Southern Leyte, or the municipalities within the province of Leyte, that you do not have to pass through Tacloban. That will be a big help to decongest our city. Okay. we are in a very serious situation here because alam nyo, we are a capital city. We have to balance and make sure our economy is steady, it's sustainable, so that hindi naman maapektuhan yung mga iba-ibang probinsya. Pagkatapos ay natuto na tayo sa nangyaring 1 year na sa pandemic na to, gamitin na natin yung natutunan natin. Huwag ho kayong kampante. Nakakalungkot. Nung tinitignan ko yung nangyayari sa Metro Manila, I could see it in the eyes of the President that he was hesitant to open up NCR. But because they were insisting, because of the economy, sabi niya, let's wait for the vaccine, and this is what happened. So, importante rin yung intuition ng mga leaders natin eh. You know, when you feel that, and, you know, we have to act. So, totoo yan, malaking problema talaga yung ekonomiya natin na kailangan masustain. Maraming nawawala ang trabaho. Lalo na ngayon sa nangyayari sa NCR. Mas marami pang mawawala ng trabaho dyan sa nangyayaring yan. But, of course, you know, if it saves lives, then that is a priority. Okay? So, explain naman sa'yo ni Attorney Aldrin will also explain the EO that I am doing, that I've signed in order to push now for stricter measures, you know, for people entering the city. Only coming from high-risk areas. Okay, I repeat. Kaya, my fellow Taclobanons at mga waray-waray man, mga Bisaya, mga tiga-region, pwede kayo mamasyal, pero I suggest you stay within the region. Because it's very delicate now sa mga nangyayari sa labas. Hanggang we get a better picture in the next few weeks. Give it 2 to 3 weeks, we will see the numbers on how it's happening. What is alarming is not only the spread of the disease, but what is alarming is the population in the hospitals. Dumadami ng dumadami, kaya hindi na naasikaso. Kahit yung mga bata, hindi na naasikaso. And by the time they get to the ICU, it's too late. Because overcrowded na mga ospital nila. So ako, usap ko talaga, we should not make that or let that happen in our city. We already know, we can see what's happening. Huwag tayong kampante. Kaya, kayo, kung may family member kayo na kailangan magpa-hospital, gawin nyo na ngayon yan. Okay, habang mababa yung numero natin, gawin nyo na kagad lahat tayo. And let's prepare ourselves, let's brace ourselves. If the numbers go up, we're prepared kahit abutin tayo ng 1 buwan, 2 buwan, 3 buwan, safe tayong lahat. Okay? So, yun lang po ang mensahe ko sa inyo that we're closely monitoring the situation of Metro Manila and the balloon areas.